Now it is my honor to introduce our special guest. Andy Melendrez was elected to serve as City Council member for Ward 2 in Riverside in January 2006 and is now serving his 4th term on the City Council. In 1982, he established Innovative Vocational Services, a company that specializes in career development for injured workers. Over the past 30 years, he has expanded its operations to include expert testimony, family law evaluations, early intervention services for the California Department of Corrections and Rehabilitation, career guidance and assessments for workers within the workers' compensation system. Councilmember Andy Melendrez is a lifelong resident of Riverside. He is very involved and concerned with the success, safety, and progress of the area covered by Ward 2, as well as the City of Riverside. Through public-private partnerships, he continues to seek innovative ways to enhance the quality of life for Riverside's residents. He is dedicated to his service on the council and has piloted unique programs with residents and community groups that have won Riverside national recognition. Councilmember Melendrez was re-elected in June of 2016 by the residents of Ward 2 to serve the community for another term. Councilmember Melendrez is now running for mayor of Riverside, where he will continue his efforts to improve our city. Thank you for joining us, Councilmember Melendrez.
Do this.
All right, we can hear you.
All right, I want to make sure. Okay, thank you so much for that wonderful introduction. And it is certainly a pleasure to be joining you today. As you had indicated, Sam, I lived in Riverside all my life. It is such a pleasure to always come on campus and to speak to many of the students here. One of the things that, little tidbit information, I went to UCR many years ago, and believe it or not, UCR was just under 3,000 students, and it's grown significantly over this time. My family's been here in the area since 1910, so we have a long history and have seen changes from the citrus groves to housing projects to the packing houses, and a variety of other things have really changed over these past years, and really been exciting to see. At the same time, very challenging for a growing city. When I was growing up, we were probably about 40,000. Now we're 330,000, and the surrounding cities around us have really, really grown as well. So it's exciting to see, but again, a lot of challenges that come along with that. And it certainly has been a pleasure serving on the City Council now in my 4th term. Is there anything that you'd like to ask of me before I begin my presentation, Sam?
I think we're ready to hear it. I'm really excited to see what you have to present.
All right. Well, great. I'm excited. Thank you so much. COVID-19 obviously has been a very important, very important to the City of Riverside because it has impacted so much. But it is a global issue, and it's a national issue. It's a state issue, it's a city issue, it's a county issue. And when you have that many governments working together, they can be very complex. There is a chain of command here that we do follow. So what we'll do is we'll go ahead and start with the very first slide. And if we can move on to the COVID-19 state of emergency slide, we'll talk about on March 4th. 2020, Governor Newsom declares a state of emergency to help the state prepare for the broader spread of COVID-19. Now, at that time, we really didn't know what the impacts were going to be. But on the left-hand side of your screen, you're going to see the proclamation of the state of emergency. And when you take a really close look at it, look at the 3rd whereas. Obviously, we have a lot of whereases when we do these types of things, but look on the 3rd one, and it says on January 23rd, 2020, the Center of Disease Control, which is a CDC, activated emergency response systems to provide ongoing support in the response to the COVID-19. And you're thinking, well, wait a minute, we knew about this in January. Well, cities and counties really weren't quite aware of that. Maybe, I mean, there may have been a lot of reasons. There were presidential campaigns going on. There were a lot of things going on. We as a city, obviously, were just kind of plugging away with our budgets and services to our community, kind of figuring out what the future of Riverside was going to look like. A variety of other things we were dealing with, pension obligation bonds, talking about CalPERS and a variety of other things. So we weren't really aware, but the CDC was aware. That's the big thing. Federal government was aware of it. So the question was, and a question could be asked, why wasn't anything done at that time? I don't have the answer to it, but I know that it has been a question that has been brought up and asked. When it became real to us was on March 4th, 2020, when Governor Newsom declared a state of emergency. And even at that time, we weren't clear as to what the impacts could potentially be. We didn't see other states really being too concerned. We heard of other things happening in Europe, in Asia, and other parts of the world. We also even saw that Mexico didn't even have an issue down there. We hadn't seen really the coronavirus in our community, so we weren't really sure what we were preparing for, other than what we heard, what was happening in Italy, some of the things that were developing in Spain. So it was something that we weren't clear, other than the governor is saying, this is important. Something is going to happen here. We need to protect ourselves. And if we have this issue hit us, our healthcare, our entire healthcare system is going to be overloaded. And we aren't going to be able to address the needs of the community just for this COVID-19 matter. That's what was being said. We need to protect our public health system and make sure that we don't populate our emergency rooms and our hospitals. So we need to start taking some action on that. So we can go on to the next slide. And on this next slide, what you're going to see are our current numbers. These numbers are only a couple days old, and this is only in the county of Riverside. You're seeing that 48,531 individuals have been tested. There are 3,942 individuals that are confirmed to have COVID-19. There's 215 that are currently in the hospital. That includes the 78 that are in the intensive care units. We've had 143 deaths, and we have 1,346 individuals that have recovered from the virus. And when you look at the confirmed cases of almost 4,000 and the recovered cases, you're looking at about a 27-28% recovery rate. So the recovery rate seems to be, a lot of people are recovering, and you see very little deaths coming out of it. So I think part of that is because you get it doesn't mean you're going to die. You're going to feel maybe like you're going to die because people have explained what it was like, but you aren't going to die. That percentage is very, very small. Now, when you take Riverside's county's stats, which you're seeing here, and compare it to Los Angeles County, Los Angeles County has over 22,000 people confirmed and over 1,000, I can't remember, 1,300 individuals that have died as a result of the virus. So they have a little bit higher death rate than we do, but obviously have a higher confirmed rate than we do, but they also have a much larger population. Their county population is, I'm sure, 3 to 4 million. I mean, it's significantly high. So, what we're looking at are numbers that are fairly consistent, although the populations are higher. So let's go back and look at the map here in Riverside County. And what you see on the very right-hand side of the county, you see Blythe, California, very little activity. Then you see this expansive area that's all gray. That's all desert, so nobody really lives there. And then you see the dots in kind of in the middle to the left-hand side of the county, which is where Palm Springs, Cathedral City, Rancho Mirage, Indian Wells was where the very first COVID-19 cases were found. And then you go further west and you'll see that big dot. That's Riverside. That's where we're at. And in Riverside, what we have is we have the highest number of confirmed cases in the entire county. We'll go on to the next slide so we can take a look at those numbers. So if we can see the graph, you're going to see the number of confirmed cases. And this is in Riverside. And the number, I'm sorry, this is in the county, and the number of deaths here in the county. And we'll go on to Riverside's numbers in just a few minutes. You're going to see that we're up at about 4,000 confirmed cases. But when you follow that graph, what you are seeing is actually a steady climb, and you're seeing that bell shape. We call it a bell-shaped curve, kind of flattening out a little bit. During its climb, what we were seeing was probably about a 12 to 15% daily increase in confirmed cases. So you saw that continue to develop, and then towards the last week and a half, what we saw was maybe 10 to 12%, and then it dropped down to 8 to 10%. Then it went from 5 to 7%, and then went from 3 to 5%. The last 2 days, we have seen in the city of Riverside about a 3% increase in confirmed cases. In the county, it's a little bit higher, but it's very consistent, and you'll see that with the flattening of the curve. So I think as long as we keep our vigilance up, we wear our face masks, we wash our hands, we do all the protective measures, we will probably start dropping very shortly. You're going to probably see that flatten out, and probably by, I would guess, probably by Sunday or Monday, maybe see us a little bit in the negative, like -1, -2. That is my hope. It's nothing that's been confirmed, but when you follow this curve, that might be what you will be seeing maybe Sunday or Monday. Now, the death rate obviously this is countywide. You'll see the same thing. You'll see it flattening out, and we hope that that will start dropping in the future. That does not mean that this is going to go away. You're still going to have them, but the amount of people that are passing away will start lessening day by day. We'll go on to the next slide. Now, these are stats by gender, and again, these are countywide. And again, it's pretty much male and female. I don't know why the difference, but you can see that they're fairly close. You have just over 2,000 females that have been infected, and then you have just under 2,000 males that have been infected. And then if you move on to confirmed age group, this is the one that's a real surprise. Most people felt that, oh, you have to be old to get there, the most vulnerable. But the biggest age group is 18 to 39 and 40 to 64. That is the highest. Those are the people that are getting the coronavirus. These are the individuals that end up in the hospitals or 14-day quarantine. And we also have very similar, although the death rate is not as high in those groups, we do have individuals that are passing on as a result of the coronavirus in those age groups. And this is countywide. We'll move on to the next slide. And as we're going through this slide, there are changes for residents, but let me go over the numbers that we've seen in the city of Riverside. In the city of Riverside, we have about 697 individuals that have been infected. So that's just under 700. Remember those first stats in the county, we're looking at 3,600 and just a little over 3,600. Just in the city of Riverside, we have 700 cases, almost 700 cases. We have also had 34 deaths in the city of Riverside. So we have the highest number of individuals that have been infected here in the city of Riverside. So we need to continue with our precautionary measures when we go out and do everything. It's extremely important that we continue with that. Now, the changes, what's happened as a result of the coronavirus? And again, one more stat that's really interesting. I look back onto March 25th of this year, March 25th of this year, we had 0 deaths and 0 confirmed cases of coronavirus. So those numbers that you saw, or the numbers that I've shared with you, and the numbers with the county, at that time, there weren't any cases in the county. Do you believe that? So this is something that moved very quickly. And I think the city governments, county governments, and state governments worked very quickly. And when you look at our numbers here and you compare them to places like New York City, where there's a high density, I mean, that is quite astonishing how California has done quite well for as big as we are in the populations that we have. But in many areas, we're also very rural. So, you got to look at those numbers, but look at them with kind of a jaundiced eye, because there are high densely populated areas that are harder hit usually than the lower density areas. Before I move on, are there any questions that students might have? If there are none, we'll go ahead and move on. These are the changes for the residents and the businesses. On March 15th, Governor Newsom issued the closure of all non-essential businesses. And these are non-essential businesses like the hair salons. You might have individuals that are doing some other types of things that are not quite important. You might have smaller stores that, of things that are just more luxury items. A variety of stores have closed. I know that there was some question on some of the, smoke shops and things of that nature. Those types of businesses closed. We also had a big discussion here in the city of Riverside regarding the restaurants, and I'll get into that a little bit more. On March 19th, Governor Newsom then issued the stay home orders. That really came to say, everybody stay home. We've got to really buckle down to make sure that this does not get out of control. We do not want to overload our healthcare system with individuals going into the hospital. And then on April 4th, the County of Riverside issued orders to cover the face when leaving your home. This is when everybody was required to wear masks. And it was because we were now starting to see an increased amount of cases from March 25th, 2020 to April 4th. Just in that short time, we started seeing a pretty quick climb. We were looking at about a 15% increase each day, just starting to gear up. So we didn't want to get into a position. So the County of Riverside was really the first one to order that cover the face when leaving home. And then some of the things that we started experience here, not here so much in the city of Riverside, but some of the other cities, were job furloughs and job losses. So individuals were laying off people. Some of the cities and counties were letting some of their individuals go because they could not accommodate them in their jobs. And also they were starting to see that this would be a financial burden on their agencies. One of the things that when we talk about governments, there are certain things that happen and certain things that we follow. So here in California, when the governor issues an order, that order is then followed by the county. And then the county issues an order, and then those orders are followed by the cities. So some of the things that you're seeing are when the City of Riverside says, you know, we're going to open up our restaurants, and maybe some of the restaurants open up, it's really the county that comes down on us and says, no, you cannot do that. No way, you know, under our orders, and we are the top dogs here, under our order, you cannot open it. What the City of Riverside had done, which I was in support of, even though the governor had issued the stay home orders, we had said, you know, restaurants, you can operate at 50% occupancy, but you've got to maintain that social distancing. And as long as you do that, we think it's okay for you to remain open. The county heard that, and 3 or 4 days later, called the restaurants and said, you cannot do that. You will be cited. And that would be contrary to what our orders are, and they were required to shut down. So we had to comply with what the county's orders were. So when the county issues an order, we can make sure that we comply with it, and that's where we issue our orders. So there is a chain of command. The governor states what we're going to do, or what the state is going to do. The county then, which is the Department of Public Health, then issues the mandates or the orders, and then the cities follow through with those orders as well. So that's kind of the structure of city government. Next slide, please. Now, the next slide, what we're talking about here is what kind of economic impacts does the city experience as a result of the COVID virus? Why were some of the individuals furloughed? Why were some of the individuals laid off? Well, some of the major areas in our area, for example, the City of Riverside, is the transit-oriented tax, which is a hotel tax. Now, this tax that we collect is tax that we apply to pay for the debt in our convention center. City of Riverside is not really renting any hotel rooms because we're not having conventions. Well, as you look down that list, the convention center has been closed, so the convention center is not collecting revenue. Well, because the convention center is not collecting revenue and you can't have individuals go into theaters anymore, the Fox Theater is not collecting revenue for us anymore. And the municipal auditorium, we've lost that revenue. And then one of our biggest revenue generators are auto sales, even though they're not closed. And then you have a stay-home order, nobody's really going out to buying cars. So all this kind of snowballs. And then there are other related retail tax that we're losing out on, the restaurants that are not opening, the hair salons that are not doing their work, the barbershops, a variety of others. So now we're seeing a drop in tax revenue. And we're projecting that out. How are we going to meet our bills? How are we going to pay our employees if we're not collecting the tax revenue? And one of the things we don't even see here now is to maintain our roads. Some of our money comes from when you go to the gas station and you start pumping gas. Every gallon that you pump helps pay for the support of our roads. People are not buying as much gas because they're not on the road and not commuting to and from Orange County or LA for work. So that revenue is also going to drop. So how are we going to manage that? And it's not anything that you see immediately, but what it is that we're going to be feeling it in 12 to 18 months. And the economy may be good, but we may not have the revenue to fix those potholes or to widen those streets or to fix those lamps. We may not even have the city personnel to go out there and do that. It would really, because we'll be operating on skeleton crews. So we're trying to figure out what our city is going to look like in 12 to 18 months. How are we going to manage that? How are we going to manage our budget? So all those things as a result of this COVID-19 are in play now for us. So that's what we're doing. And we are very, believe me, we're working very hard at it, and we want to be able to provide those basic services to the city. But now we're scratching our head on how are we going to do that, and what are the end result of the fiscal impacts to our city. If we can go on to the next slide, please. Our next slide really has to comes down, and we're going to step back. We're going to go down to city ordinances. What have we done to kind of help our community? Because we know people were going to be losing jobs. We know that they're not going to be able to pay their mortgages or their rent. Maybe public utilities is another one. How about the businesses? We're going to be operating on skeleton crews, people that come in to get permits. What is happening there? So we'll move on to the next slide, and we're going to share with you what was the very first thing that we did here in the city of Riverside. And when you look at this, you're going to see that there is a suspension, a temporary suspension of utility shutoffs. The city of Riverside owns our own water and power, which is our electricity and our water. That's one thing we had immediate control over. But keep in mind, if an individuals aren't able to pay their utilities, you know, we have an obligation to keep our water and power on. So if somebody doesn't pay, or you have a large percentage of people paying, that's something that's going to impact us down the road. We know that. But we also don't want to leave individuals without electricity or without water. So we put a temporary suspension of utility shutoff for a period of 30 days. And we will be extending it, and we're going to go every 30-day period, kind of measuring what this coronavirus and how long it's going to last. We started this, and it was brought to the council and approved on March 17th. So that's one of the things we did to try to safeguard our constituents. Next slide, please. The next thing we did, knowing that people were not going to be able to work, as a result, we brought forth an eviction moratorium, which meant that during the month of April and May, you could not evict your tenants. Now, that doesn't mean that the tenant can say, guess what? I'm not paying rent because I don't have to. That's what the moratorium says, and you can't evict me. Ha ha. That's not what it says. What it says is that if you were affected by the coronavirus pandemic, meaning you lost your job or couldn't go to work for whatever reason, you are still obligated for that. You're still obligated to pay that rent, but you don't have to pay it now. You have to pay it later. That doesn't mean you don't have to pay it. That just means you'll pay it later. So if your rent was $1,000 a month and you paid $500, you still have to pay the $500 later, and you have to make arrangements with that landlord. But you also have to provide the landlord with a letter or some proof that you were laid off your job as a result of the coronavirus matter. And you need to get that letter or some kind of proof from your employer. You also have to let them know at least 7 days in advance to let them know, or within 7 days. So, you know, it's not as if you just don't have to pay. It's you do have to pay, and you have to provide proof as to why you don't pay. One of the things that we've always, and we do have this in the resolution, is that you are obligated to pay, and pay as much as you can, because you don't want to have that balloon payment at the end, and you will have to, you know, because you will have to pay it anyway. Now, this was an eviction moratorium for both not residents, but also some of these small commercial properties. Next slide, please. Now, the other part that the coronavirus has affected is the homeless. We don't really think about the homeless. They don't really have rent. A lot of them are living, you know, on the street. Some of them maybe were living with other families and were temporary homeless. But we needed to create more services for those that maybe lost their job and maybe had their home taken away prior to. And then you had the individuals who are experiencing homelessness as a result of a job loss. We expanded emergency services at Hewlin Place, that is our homeless shelter. And we extended our emergency shelter operations to May 15th. And also the emergency shelter to expand operations to operating 24/7. The other thing that we have done that's not included in this slide, we know the homeless also get coronavirus. So we had many nonprofit medical services and medical outreach to them, informing them. If you've seen a homeless individual wearing a mask, it's because we have gone out and spoken with them, provided them information, and encouraged them to use the mask, not to, so that they wouldn't spread the coronavirus or receive it. So we did everything everybody else is getting. We're reaching out to as many homeless individuals that we can to make sure they receive the same service. We'll move on to the next slide. Are there any questions before we begin? Sam, any questions that have been brought to your attention?
Yeah, I have one question from one of our ambassadors, Paula, and she was wondering if there would be, this is back when you were talking about utilities, if there would be repercussions to the 30-day period for utility after everything passes. So basically, if once we pass this 30-day period, are citizens going to be required to pay for the utilities during that 30-day ordinance that allowed citizens not to have to pay for the utilities?
Yeah, well, it's like anything else. We ask you to pay, at least make partial payments. That is going to be extended for probably up to June 1st. So it'll be a full 60 days. I don't think there's any problem. Our public utility company is willing to work with them in regards to a payment plan. So if maybe you didn't pay utilities for that month, you're still obligated to pay, but we will work out a payment plan. It could be for 4 weeks, it could be for 6 weeks, it could be for 20, it could be for 20 weeks. Just depends on your situation. So it's like anything else, there is still an obligation to pay. If you fall into a different category and you live in the city of Riverside, an economic category, you can also apply over at an agent. You can apply for the SHARE program, and the SHARE program is where you receive assistance for your utilities, and that is a service that would be available to you as well if you fall within that low income status, and we could provide some assistance to you that way as well.
Great, thank you so much. And I actually have another question by one of our ambassadors, Maya. I'm gonna introduce her right now.
Okay.
Maya, do you mind asking the council member your question?
Yeah, recently in San Francisco and Los Angeles, hotel rooms were provided to the homeless. Is that something we could see happening in Riverside?
And I'm sorry, what was that? Repeat the question one more time.
Oh, sorry. Recently in San Francisco and Los Angeles, hotel rooms were provided to the homeless. Is that something we could see happening in the city of Riverside?
It's happening now.
Oh, okay.
Right? Yeah, it is happening now. When you go down Magnolia, you're going to see some hotel rooms that are pretty full. Now this is the interesting part, and I'm glad. Thank you for bringing that up. And the county, I believe, had leased out, because we worked with the county on this, and they've leased out hotels countywide. I thought they'd indicated, and it sounds high, but I think there was about 800 different hotel owners that were willing to work with them. I know of at least 3 hotels in the city of Riverside that are being occupied by the homeless. Now, this is one of the challenges and something that's not talked about, but I think it's something that obviously I'm going to be bringing up. The individuals that are homeless obviously we've seen them on the street. Some of those homeless individuals need greater supervision. And they sometimes don't know how to, let's just say, behave themselves, or don't take their medication regularly, which is part of the problem. But the other part of the problem is the hotel staff is not trained to deal with those issues. So we need to work on that a little bit more and figure out how we could more effectively be able to provide the housing for the homeless in the hotel, but also provide them the services which help them stabilize so that they're able to not just go back out on the streets when the lease ends, but that they start making that transition into either affordable housing units, or connect them with the counseling that they need, or provide them with the foundational services that they're going to need to move forward and be successful. But we have begun the hotels and have been doing that here in the city of Riverside. And so have surrounding cities. I think City of Corona, City of Moreno Valley has done the same. Okay. Are there any other questions?
It looks like we have one more. I'm going to introduce Paula. She asked a previous question and she can ask you right now.
Okay.
Hi.
Hi, how are you?
I'm doing good. I actually had another question. It's regarding the actual intersection of the freeway. Did that have any effect on the prevalence of cases here in the city of Riverside, being that we do have the most cases in the county?
I'm sorry, repeat that one more time. I'm going to raise my volume on there. It's probably on this end. Go ahead.
Did the intersection of the freeways that intersects here in the city of Riverside have anything to do with the prevalence of cases within Riverside, being it that we do have the highest number of cases within the county?
Well, the freeways are actually managed by Riverside County Transportation Commission and the state of California and Caltrans. What they kind of work together. So we are not isolated from that, but I'll give you an example. Riverside County Transportation Commission is a countywide commission. So you have a member of every city being represented on that commission. And they decide how state monies or grants or federal monies are going to be distributed throughout the city. Caltrans has full responsibility of the freeways, and they have their funding that funds the freeway. So when we talk about the freeways themselves, RCTC will provide some money partnered with Caltrans money, or fully fund something on their own for freeway maintenance, not so much maintenance, but freeway widening, freeway improvements, and those types of things. So out of all the cities, we as the city of Riverside would have one voice in that group. I don't know if that explains that to you. So our responsibility of the freeways is very minimal. That's predominantly Caltrans. And if Caltrans has an issue that needs attention, we will work with Caltrans. The freeways are also patrolled by the Highway Patrol, not the city of Riverside. I don't know if that helps clarify that question. No. Okay. Maybe you could rephrase the question.
So it was more so geared, did like the fact that Riverside is intersected by a freeway have any impact as far as like COVID-19 cases, like helping it, you know, become more prevalent within the city, or was it more so other factors?
Yeah, it would be other fractions. I don't think that the freeway is divided with an issue. I think it would be, you know, what really has impacted the city is on this matter has predominantly been the stay home initiative that basically says don't go out, nobody goes out, nobody comes in and invests in the city of Riverside in terms of what we were accustomed to having. If you're familiar with the food lab that we have downtown, completely closed. Well, it was jam-packed every day. The impacts have been pretty much everybody stay home and be safe and don't spread the virus. That's been the whole thing. That's been the biggest impact to the city of Riverside. But there are no physical barriers that have really made a difference at this point.
Great, thank you so much, Councilmember. And I think that's
Sure.
all the questions we have right now.
I'm sorry, what was that?
I think that's all the questions we have right now, but I'm sure we'll start getting some more. We continue.
Okay. So we have the assistance for local development. On March 31st, the council extended entitlements and construction related to permits up to 6 months. And I'll tell you why that's important. Before this, the COVID-19 hit, a lot of the construction companies were moving ahead with great projects here in the city of Riverside. And what happens is that a lot of that has to do with timing and funding for them because they have to get loans and they have to do all these other things. And then there are timeframes that are written within our own codes that basically say, once you've pulled a permit, you have so much time to complete that project. And once you've completed that portion, then you have so much time to have the next project, part of the project done. That's so you don't have projects just laying around wondering when they're going to be done, or you have old structures that stand up for 6 years and nothing happens to them. So the developer knows what the process is. We had to extend those entitlements because we're working on a skeleton crew and couldn't get to all those projects. And generally, if you don't meet that criteria, either the project completely stops or there are fines that are associated with that. So we needed to extend those entitlements on construction related permits, which is another thing that we needed to do. We can go on to the next slide. Economic impacts. We talked a little bit about economic impacts. These are some of the sales tax revenues. I thought this was going to be taken out of the thing, but well, let's go over it anyway. It says at the end of our most recent completed fiscal year, which ends which ended June 30th, 2019, sales tax revenue for the city of Riverside was $69,512,374. We keep pretty good track of our money. And for the general fund, and for Measure Z, which is our 1% sales tax, it was projected at it was actually 64,643,760 for Measure Z. So both of those are severely going to be impacted. We're looking at probably about $8 to $10 million in terms of a shortfall, which out of a $230 million budget doesn't seem to be a lot of money. But when we talk about a balanced budget, what we talk about is the amount of revenue coming in and the amount of expenses, and they need to meet exactly. And when that doesn't meet and that revenue goes down, then the services you provide here need to go down, which is services, material, employees, and such. So we're looking at probably, I would probably say at least an $8 to $10 million shortfall just in that portion. So, and then we talked about the lost revenue of the convention center. We talked about the lost revenue of our TOT, which is the transit oriented tax. We talked about lost revenue from the Fox Theater, and we haven't even talked about the Tyler Galleria lost money from the Tyler Galleria and all the real retailers around that. So it's been we've been working and watching these finances very close. So that's where we're at from a financial standpoint. We don't know what the impacts after this are going to be, and we'll get to that in just a few minutes. We'll move on to the next slide. And the next slide really talks about what is the roadmap to opening it back up. And these are steps that the governor has outlined. And again, these are things that we're looking forward. So we're not really out of the woods yet. And these are steps that don't happen immediately. So we're at the first step right now to continue to build out testing. We want to test as many people as possible. Contacting tracing, PPE, and hospital surge capacity. We're not out of the woods. Remember, I indicated that we're still increasing daily about 3% of those that are being infected by the virus. That has not gone down. It continues to climb. We'll probably be, by the end of today, we'll probably be easily over 700 individuals only in the city of Riverside infected by the virus. Then, we're going to continue. We know we're going to continue to lose revenue, and until that starts going down is when we can really more effectively plan what our city is going to be looking like in the next 3 to 4 months and get a better handle on our revenues. So we're still in the process of losing revenue, even with these stages that you're going to be seeing, what I'm going to be showing you here in a few minutes. So making, also the last bullet here is making essential workforce environments as safe as possible. And the essential workforce, again, we're talking about the pharmacies, we're talking about the grocery stores, we're talking about those other essential occupations. So some of the auto repair shops, collision shops, and things of that nature. We still need to make those safe and as safe as possible. We'll move on to the next slide, which is we have stage 1 on there twice. Let's go on to stage 2. There it is. Low risk workplaces, gradually open up some of the lower risk workplaces with adaptations. Some of our retail, we're doing curbside pickup now, but how do we expand on that? Some of our manufacturers that needed to close down, some of our offices that needed to work, how do we open those back up when telework is not possible? And then some of our more public spaces. Some of the things you probably heard of this past week, that we opened up our parks, and those parks weren't fully opened up. What happened with those parks is that we are opening up for jogging, utilizing our trails, playing tennis, the frisbee course that we have, and a few other things. You still can't have sports like baseball or basketball or any contact sports there yet, and also picnics and things of that nature, and the children's playgrounds are still all closed. So we're starting to make evaluations now on how we're going to open those back up. Mount Rubidoux, which is a very popular walking trail for us, all the way up to the top of Mount Rubidoux. The place is usually packed. You have a lot of people that congregate over at the Tekaskeet Park or Ryan Binominio Park, and then walk up to the trail. We're going to be working on that because we know social distancing there is quite a problem, especially for as often as it's used. So those are things that we're still working on. We have not quite gotten to stage 2 yet. Let's move on to stage 3. And stage 3 really talks more about churches. When you see there down at the bottom, churches and weddings, entertainment venues like the theaters and sports, maybe without a live audience, personal care, which is hair and nail salons, and the gyms, and that those are higher risk environments. We haven't even started discussing those yet. So when we look at those, you ask, well, how far are those out? Well, we're waiting for the governor, but at the same time, we're telling the governor we need to open these places up. These may not be till July. Some people are talking about August. So, these are still things that are far away. Again, the further we push out, the more of an impact it has on our budget. Let's move on to the slide 4. And stage 4. And in stage 4, you're going to see that even higher risk concerts, our convention center, which provides revenue, our live audience is sports. We have a small soccer team, or even basketball games or baseball games at UCR, concerts. We can't open up the Fox Theater. We're probably not looking till September on some of these, unless some things really start to move really quick, or we see a sudden drop in the coronavirus matter. So everything is still in play. We're playing it by ear, but the longer these stay closed, the more of an impact it has on our city budget, the more of an impact it has on our county budgets, and the more of an impact it has on our state budgets. And what we're seeing right now is we'll probably have to dip into our reserves, and we hopefully have enough reserves to cover the cost of providing the basic services to our community. So that's kind of what we're looking at right now. And this is kind of an umbrella look at what we're looking at nationally, from a statewide level, county level, and also the city level. Do we have another slide? Let's see if we have another slide to talk about. Nope, that's it. You can catch me on all those things, Twitter and all the other stuff. All right, if you have any questions, I'd be more than happy to answer them now. Some of the most common questions that I get really have to do with, at this point, especially amongst our constituents, have to do with the rental or the eviction and some of the public utilities. The questions that we have also, what we've done is we've gone as a city council, we've gone to having remote meetings where I'm at now is how I participate in our city council meetings. There have been a waiver, a variety of things by the governor. We used to have city council members, we used to have public comment where they would be able to talk to us. Now you can do that online prior to our city council council meeting. By phone, you can call us and speak to our city council, and we respond to our council, our constituents in that manner. So we try to keep everything moving as best as possible, but when you're dealing remotely, it's a different feel to a city. Our city hall has been closed now for over a month. You cannot get into city hall. It really causes an inconvenience for a lot of individuals, but because of the mandate by the governor's office and the requirements by the county, all city halls, county buildings, our county courthouses are also closed. So if you have a court matter pending, you can't hear it. It's affecting our attorneys who rely on going to court to make their money. They're not going to court, and unfortunately having some financial challenges there. So there really is a trickle effect to a lot of things here.
Great. Thank you so much, Councilman Melendrez. We all really appreciate this seminar, and it's been very insightful. At this time, I would like to now open it up for questions from the audience. If you haven't already, please send me your questions via the chat function directly to me, Sam Roberts. I'm also joined by my fellow deans and ambassadors who may pose some questions as well. I know Camila had a question. Camila, if you'd like to ask the councilman your question.
Thank you, Sam. The question I had, I see a lot like on social media or in the news that people are still not sheltering in place. They're still going to beaches, they're still going out of town, going on dates and things like that. Is the County of Riverside doing anything to reinforce repercussions to those who refuse to shelter in place, or anything to that extent?
Yeah, yeah. You know, one of the challenges when you look at this pandemic at the federal government level, the entire United States was seen as a disaster area. That's what it was. And when you think about this pandemic, think about it as a jolt. Boom. You know, what happens when an earthquake hits? How many people are you going to get sheltered in a week? You know, when the shelters themselves are down or overcrowded to begin with. So when you think about this, government is working as quickly as possible. And yes, there are individuals that are not sheltered. So everyone is working as hard as they can. And remember, the government relies on the community or the people's revenue to provide those services. The federal government issued the very first stimulus package, which was $2.2 billion. The way that stimulus package was funded was by borrowing the money. The second, by borrowing the money. So there's only so much borrowing you can make. The counties and the cities, again, to shelter everyone, we need to find the money from somewhere, especially if we're utilizing it already to shelter the homeless and shelter those that have recently lost their jobs or things of that nature. So I think governments are doing the best they can. We don't always work the fastest, but we worked pretty quick in these past 5 weeks to try to meet those needs, and there's still more need out there. It was hard for us as a city to meet the need prior to the pandemic. It's even more difficult now, but we're doing all we can. I know the county is working very hard at this, and the state of California is also working it. And what you're seeing now is you're seeing two things happening. You're seeing trying to open up the economy, but at the same time trying to still deal with some of the residuals of what happened 2 or 3 weeks ago and the COVID virus that has impacted us. So we're a lot of things going on right now. Thank you for the question.
Thank you. And now we have a question from an audience member, Andrea Reyes. She asks, if we see a number of confirmed cases start to arise as we continue to move forward to the next stages, do you believe we will revert back to the stay-at-home order?
Okay, was that the question there?
Yeah.
Okay, you broke up a little bit. I couldn't hear the whole question. On my side, it broke up.
All right, let me repeat that. If we see a number of confirmed cases start to arise as we continue to move forward to the next stages, do you believe we will revert back to the stay-at-home order?
Well, the stay-at-home order has not been lifted. In fact, the stay-home order has been extended. And what has also, well, we're looking at, I mean, they're talking about May 15th. I think we're going to extend it to June 15th, and we know that the masks are going to have to be worn until June 15th. So we haven't reverted back. The stay-home order is still intact. We'll have to see how much longer that's going to go, but it is coming up and it's coming due. So I think what you're going to start seeing is a more proactive approach on making sure that individuals are utilizing all the protective measures, but allowing a little bit more freedom. But we're not quite there yet because the amount of cases for the coronavirus is still growing. We haven't flattened out yet. We're still growing at about 3%, 3 to 5%, depending on where you live, and especially in the more highly populated areas. That's where you're seeing the coronavirus. And again, what you find is you find a lot of hotspots that are in different parts of the country and a lot of parts of the state. So to uniformly say we're going to stop it here, it makes it extremely very difficult. But what you are seeing is you're seeing people wanting to turn that corner and making sure that we take every precaution to make sure that we don't further spread the virus. And again, people have talked about the second wave being even worse than the first one if we don't take care of this first part first. I mean, this part first.
Great, thank you for your answer, Councilman. I actually have a few questions myself that I was thinking about when you were giving this presentation, and I'm wondering, I think one question I have, and this applies to a bunch of the students in our audience too, is are there any ways we as students can get involved in the City of Riverside to help those in need? I know are there like any volunteer or nonprofit options where students can volunteer at to help the public?
Yeah, one of the biggest issues that we've had are access to food. And we have had some really great partners come out, whether it be local churches that have done that. We have in our area, we have the Seventh-day Adventist Church, obviously welcomes everybody. The homeless shelter, working with individuals there. You have the Food Harvest Bank, obviously relies heavily on volunteers. A lot of things. What we also, the county has called for medical workers. If you have a medical background, to help them in volunteering and caring for some of the individuals that have symptoms or have the coronavirus. One of the things that we did not talk about in some of those statistics, that a large percentage were individuals that worked in the medical field that were exposed to coronavirus through their patients. We don't have those specific stats, but we know that there's always a large percentage of healthcare workers that get infected by the individuals who they're caring for, just because of their close proximity. So my hat goes off to the nurses and the medical workers that have really been the frontline individuals in this, in providing the care and recuperation of many of these individuals. But that's who I would call many of the nonprofits, food banks, local churches, Our Lady of Perpetual Help here in the City of Riverside, Catholic Charities. Many of those are looking for volunteers and help. And many of them do food delivery to people's homes who are not able to get out to purchase the food.
Great, thank you. I was also wondering, and before I ask this question, I want to remind the audience, if you do have any questions, please either enter them in the Q&A box or send them directly to me, Sam Roberts, in the chat, and we will ask them to the council member. But I'm wondering, I know over the past few weeks across the US, we have witnessed thousands of protesters gathering to fight against the stay-at-home orders. And I'm currently back home in Santa Cruz, so I don't have too much knowledge of what is going on in Riverside, but I'm wondering, have there been any protests in the City of Riverside? And what would you say to citizens who are refusing to cooperate with these stay-at-home orders?
Yeah, there was I think we had 2 or 3 protests about a week and a half ago around City Hall and on the steps of the courthouse. And these are individuals that really want to get back to work. And it really depends. I mean, they vary in degrees. Individuals are not really seeing this as a pandemic, don't have any fear of catching it, basically saying, we just want to get back to work, open it up, we're being held hostage. That's basically what their sense is. While others are saying, hey, we know it exists, but we need to get back to work. We will take do all the precautions needed, but we need to go back and make a living. I'm self-employed. I've been self-employed for 38 years now. Well, it'll be 38 years on July 1st, but I have no unemployment benefits. I have no, I wouldn't qualify for any of those services that other employees are eligible for. I'm very fortunate because after 37 years, you build up a reserve and you build up a savings to carry yourself over in case things don't work out right. Some of these other businesses have not been in business all that long or long enough to build up a sufficient reserve. And maybe their reserve was only for 30 days and they totally exhausted that. It becomes a hardship. So they need to get back to work. One of the things that is important to do is reach out to your landlord and talk to them about how we're going to be able to work through this after the pandemic and making those rent payments. And the landlord themselves have mortgage payments to pay, so they need to reach out to their banks and figure out what they're going to do. So the frustration is there, especially among those that are self-employed, and they need to get back to work. They don't feel that they're getting a response. They don't know what's happening. And then when you see the phases, you're looking at phases that carry you all the way into August. We've only been at this 6 weeks. We still have all of May, June, July, and August. That's 4 months. That'll be pretty close to half a year. And a lot of businesses cannot. There is no way that they will be able to support themselves over that period of time. So that's where the anxiety and the frustration is building up. And I truly understand that we're so close on this pandemic and leveling this out. Let's just continue and be vigilant on those precautionary measures so that we can make it over this hump. I think we're going to start seeing, as I indicated earlier, maybe Sunday or Monday, we see a little bit, hopefully different numbers that trend more downward. But it's got to be a two-way street. All the precautions, all the vigilance, but at the same time work with us in working and opening up those businesses. But yes, frustration, and I totally understand that.
Great, thank you. That's great advice. I really appreciate that response. Right now, it looks like we have a question from one of our ambassadors, Paola. I'll introduce you. Why don't you ask your question?
Hi, so my question was actually based off your comment as far as food access. There has been media circulation of mass food waste in the country due to the decline of restaurant revenue and the inability of farms to directly donate produce to food banks. Is the agricultural industry in Riverside facing the same problem?
Well, I'm not aware of that. There are certain foods that are routinely not accepted simply because of health issues and health requirements. But in terms of, I think most of our nonprofits here in the city of Riverside are pretty clear about what they will receive. So, we can receive prepackaged food. They may not be able to receive meats that have been on, for a while, and they don't know where they've been because of health issues. But I think our nonprofits here have been pretty clear about what they can accept. So the frustration might be, sometimes on news media, you don't always hear the entire story. So there may be food that wasn't traditionally accepted by some of the nonprofits anyway, trying to be given to them, and they couldn't accept them because of health issues. So I'm not, we haven't seen, and I'm not aware of it here in the city of Riverside. What I was aware of very early on is people being so concerned about the pandemic, going to grocery stores and buying this tremendous amount of food, and the shelves were cleared out. And the grocery stores have done a great job in limiting and trying to moderate that a little bit. So you have a lot of things that are happening during this time, but that part I have not been aware of here in the city of Riverside. Okay.
Thank you. And I had another question myself. I was wondering, I know there's the stimulus checks were recently released, and that covered a lot of individuals, but noticeably all immigrants, a lot of undocumented immigrants were left out of that stimulus check. And I'm wondering, is there anything being done in the city side to provide assistance for immigrants who may not be receiving these stimulus checks or aid from the federal government?
Well, the assistance that you're speaking of usually coming through the county and the state level. I was just in a meeting earlier with 4 assembly members, and they were talking about that exact same thing. And their efforts at the state level was trying to be able to provide services to everyone and provide the assistance they need to support themselves and those that have had job losses as a result of the coronavirus matter. But that is something that they are working on at the state level, and they have been in discussions with the governor about that. And so I'm sure we'll find out shortly. Those were exact same questions that were made by some of the participants that were in that meeting as well. And the assembly members did indicate that they were working on that matter.
Great, thank you. I have a few more questions. I'm wondering, early on in the slides, it said around 144 inmates in Riverside's prisons were sick with COVID-19. In New York, you see with Rikers Island, a huge number of prisoners who are sick, and they're actually, they've been releasing some prisoners who have committed lower level offenses. I'm wondering, how is Riverside handling prison safety in order to ensure that inmates and staff do not get COVID-19? And are we seeing some prisoners being released early in Riverside?
Okay, you're breaking up towards the latter end. I heard that the number you looked at was 144 inmates that had coronavirus, and that part, just that part, and then we'll go on to the second part. That part, when you notice how many had recovered, it was 108. They had a higher percentage of individuals in the jails that had recovered from the coronavirus than the greater population, which is really an interesting stat. And I put these numbers together last night and I noticed that, and I thought, wow, I'm gonna have to find out why the recovery rate or how they got the recovery rate so high. And it might be because they're closely monitored and checked and all the other things. But I don't, when the individuals that are released from the jail, it is obviously a concern to the city of Riverside, because what happens, and this deals with other things, and we go on to other matters, but let's say an individual was arrested in the city of Moreno Valley or Paris or Lake Elsinore, and they're brought to Riverside jail. Let's say the individual connected coronavirus. Well, when that sheriff brings them to the jailhouse here, that sheriff goes back to his area. The individual that has been booked eventually gets released here in the city of Riverside, and no way to get back to where they were originally arrested. It happens with just about with everybody that is in the jail now. So if an individual is in the jail and has coronavirus, we would hope that the jail would keep them or transfer them to a location until, a hospital or another setting until they fully recuperated. That's a good question. I don't know. I'm going to need to find out, because I would hate to think that they are being released from jail knowing that they have coronavirus and not being and allowed on the street. But that's a very good question. I don't know the answer to that. Thank you for bringing that up. That is one that I am going to be following up on.
Great. And then my last question, I'm wondering, just to sum up this whole seminar, and I'm wondering, what do you think the City of Riverside has done successfully in responding to COVID-19, and what do you think the city still needs to work on?
Okay, what they respond, and the last part again, you broke up a little bit.
What do you think the city has done well in its response to COVID-19, and what do you think it still needs to work on?
Okay, in response, one of the things that I have really been impressed with, and I know my community, and I felt good about it the whole time, they're very respectful in terms of following what needs to be followed. We have done, when we put out, or the county has put out, a mandate or stated, you can't do this or you can't do that, and wear your protective mask. They have responded extremely well. If you've ever walked down the sidewalk, you're probably noticing sometimes the people that are walking towards you trying to jump off the sidewalk to make sure that there's enough room for you to walk by and you aren't so close to each other, wearing the protective. If they're walking, sometimes they don't have the mask on, but always very respectful and taking a lot of precautions. That is a good thing about the city of Riverside and our residents. They've been very good. I think that's our strength. Where we have not, I think we're catching up to it. But one of the things that we have not, and we're turning the corner on that, is letting the community know how we're going to open up and laying out the plan. The plan has just come out this past week, which kind of led to that frustration and those protests that we talked about. But they didn't know what the plans were. They didn't know how long it would last. I think we need to do a better job in getting that information out to the community so they understand more thoroughly what the plan is. I think the plan that has been put out by the governor has been good, but I think it's a little bit more prolonged than the community would like to see. It's not as specific as they'd like to see. But I will tell you, when I share with you that the Barbers Association and the Restaurant Association has already put out recommendations that outline, this is what we've done in partnership with medical doctors to pertain the most sterile and the cleanest environment that you could have to limit and minimize the spread of coronavirus. That helps. When that news gets out, that really helps the electeds, and it helps the individuals in the field know that there's something being done, that there is a direction being taken, there are recommendations being made, so that the sooner we have that and evaluate it, we can take action on it. And we need to do a better job in doing that.
Great, thank you. And it looks like we have one more question from our ambassador, Camila. Camila, if you want to ask your question.
Thanks, Sam. I have one more question to ask. This is like a very sensitive time for everyone, and especially those who are pregnant and have just given birth to a lot of newborn children. So is the County of Riverside providing any extra aid to pregnant women who may be testing positive for COVID-19?
I'm not sure. That would be a question for the Riverside University Health System and the public safety. One thing that I do know about the county is that they have invested a lot of money in health. They've also invested a lot of money in making sure that the homeless are being sheltered, as many as possible. They've done a lot of outreach to coordinate that. They've also worked very hard to make sure that if you've lost your job through their workforce development, they try to get you back to work. There have been a few stories that I've heard about women that had the COVID-19, and there are a lot of information that they're disseminating on how to care, how to be proactive, and making sure your doctor knows, and how to take care of yourself during that time period. So they're making a lot of efforts. But I do have a question for the students and the ambassadors, because now that you have this information, knowing that the impacts that the cities have, and you also know that the coronavirus is still increasing, where do you see this ending? What do you think is going to happen in the next 4 or 5 months? And if you were an elected official, how would you handle it? And what would you tell your constituents?
That's a good question. I've been thinking about this a lot, just how it pertains to us as college students, and really thinking about, I'm a graduating senior, so I won't be attending UCR in the fall, but I've been really trying to understand, is it a possibility for students to come back to Riverside in the fall? And from what I've been thinking about and from my understanding of my research, keeping up with the news, it seems like this isn't going to be, unless drastic changes are done to the way school is being taught in person at UCR, where there's very limited seats for classes and intense social distancing happening in these classrooms. it doesn't seem like it would be possible for that to happen on campus. And again, that's just my opinion, but that's kind of what in response to your question, where I see it, if you see that.
Yeah. You have multi-million dollar companies that are saying, we're losing money on this. We really need to get back on, you see farmers that are dumping all these potatoes and all this food that they can't sell because there's no need for it. I mean, people are not buying the way they used to buy, and they're maybe cooking at home more often than they used to. So it's really shifted the economy and really provided some challenges, not only for city governments, but for the farmers who don't know what to do with their product because they have not been able to sell it.
Well, I think that may be all the questions we have now. And unfortunately, we are nearing the end of the seminar. But Councilmember Melendrez, I would like to thank you so much for taking the time out of your busy schedule to join us today for this discussion. And I'd also like to thank the audience members that attended this webinar series today. The UCR School of Public Policy seminar series will continue on May 12th with the discussion with the mayor and city manager of Palm Springs. You can learn more about this at spp.ucr.edu/events. Till next time, have a good day. And thank you so much, Councilmember Melendrez.
You're very welcome. Thanks for having me. Take care. Have a wonderful afternoon.
Thank you.